Jamie Hale is a wheelchair user who's relied on Britain's National Health Service, or NHS, for most of his life.
Without a viable NHS, I wouldn't be here, and if the NHS collapses, I don't particularly credit my chances.
In April, he decided to undergo major surgery. 5 months later, he's still waiting for it to be scheduled.
It's difficult and frustrating. It impacts on the way I can live my life, the amount of pain and discomfort I'm in.
During the last round of strikes in May, Jamie had another procedure delayed 2 weeks. One of a million medical appointments postponed since December thanks to healthcare strikes. Hospital leaders and public health officials call the current situation dangerous, warning continued strikes create an enormous challenge.
The strikes this week represent the biggest industrial disruption to Britain's nationalised health service in its history. They will mean longer delays for patients already waiting months for treatment or surgery, but they also highlight a workforce and a system that's close to breaking point.
Senior doctors in England began striking Tuesday. On Wednesday, junior doctors joined them, leaving just limited medical cover nationwide. And on Thursday and Friday, tens of thousands of junior doctors will provide no service at all. Senior doctors have seen their pay fall 17% in real terms since 2010. The government this year suggested a 6% increase. Junior doctors also saw a drop of up to 17% during the same period. They were recently offered a 9% uplift. 2 in 3 UK doctors belong to the British Medical Association behind this strike, including Dr. Arjun Nagra, a London doctor early in his career.
The strength of kind of the unity that we've got amongst us is at an all-time high, and that's only because doctors realise this is the last chance saloon for us. It's kind of the last throw of the dice. It's now or never to save our profession in this country and to restore it.
Britain's health minister hasn't held talks on pay for 6 months, and this week announced plans to force doctors back to work.
Prime Minister has been clear the position for pay this year has been agreed through the pay review body process, and that is the government's position.
Despite the delays Jamie faces, like many British residents, he still supports the doctors' demands.
That's what I care about, is knowing that there'll be an NHS in 5, 10, 15 years' time, not whether I end up waiting another month now.
Many similar sacrifices may be made this week, but without higher salaries, there remain no simple solutions. Willem, Marx, Al Jazeera, London.